Good day everyone, this is Heber E. Lapiceros, a student nurse from Davao Doctors College, and today I'm going to perform or demonstrate the cranial nerve assessment. So prior to doing the procedure, we need first to review the client's previous medical records and doctor sheets if available. So this is to verify the order. Okay, so after that, we need to determine the scope of assessment needed. We need to prepare, of course, the necessary equipment. This is to ensure the organization and increase efficiency when performing the assessment. So, while performing the cranial nerve assessment, we just need to have our cotton balls and our toning fork, and of course, our pen light, our tongue depressor, gloves, clean gloves, and of course our Snellen chart while we are performing the visual acuity of our patient. After performing the hand washing, so this is very important because this is to prevent the spread or to prevent the spread of microorganisms. So now is we need to greet our client politely. So we need to introduce ourselves and verify the client's identity, and we need to ask how the client would like to be called during the assessment. So we need, and of course we need to establish rapport. So in introducing ourselves, this is to enhance rapport. So verifying the client's identity ensures care is being rendered to the correct client. So, sir, kumusta sir?
Okay lang.
Okay. Ako nga pala sir, si Heber Ilaticero sir, your student nurse mo for today sir from Davao Doctors College, no? So, can I check your response sir? Can you please tell me your name, age, and birthday?
My name is Wilfred Rosales and I'm 20 years old. And my birthday is April 27, 2001.
Okay, sir. Ano gusto na akong sir tawag sa inyo, sir?
John na lang.
So, Sir John, so after verifying the client's identity, now is we need to explain the procedure so to our client, and of course we need to how or he can participate during the assessment. So, and of course, we need to provide the client the opportunity to clarify, ask, or raise any concern. So, the rationale for this is explaining the procedure to the client can reduce the client's anxiety, and of course, it will enhance the cooperation. So, sir, karon sir is I'm going to perform sir cranial nerve assessment. Sir, when we say cranial nerve assessment, sir, it is part of the neurological examination. Sir, ako ni-assess via the aid of physical examination. Sir, kung naabay mga, for example, sa visual acuity mo, sir, and sa the way how you perform, the way how you talk, and the way how you behave, sir. So, i-assess natin, sir, kung naabot ay makita ng mga abnormal findings, kung naaman, and hopefully mga normal findings na lang, sir. Okay, sir? Naaka pa yung mga laing pangutana, sir? Sir John?
Wala naman, sir. Okay na po.
Okay po. Now is we need to ensure the client's the comfort and of course the confidentiality, and providing the client's privacy protects client's integrity and enhances comfort. So assessment setting was assured to be safe, secured, and free from distraction. So position the client to be seated comfortably. So in women, we need to drape the anterior thorax. This is to with being examined, this to prevent from being exposed the anterior part of the women. So since my client is or my patient is a male, so there's no need for me to drape the anterior thorax. Okay, so inadequate lining enhance visualization of the assessed part, proper positioning facilities client's comfort and efficiency in performing the assessment. Okay, sir. Before sir mag-proceed ako sa cranial nerve assessment, sir, okay lang ba sir kung i-close ko yung portahan at yung bintana, sir?
Yeah, sure.
How about sir natong aircon, sir?
Okay naman ako sa ganyan temperature.
Sir, so i-close ko muna yung sir. Okay. Assessment of the cranial nerve Cranial nerve number 1, olfactory nerve. So prior of doing the procedure, we need to ask our client to clear his nose, to remove any mucus, then close his eyes, then occlude the one nostril. So and identify scented object that you're holding, such as coffee powder or bar of soap. So, and of course, we need to let the patient describe the smell. Okay, by clearing the nose, it helps to smell thoroughly. So clogged nose are actually caused by inflamed blood vessels in the sinuses. Okay, sir, I'm going to perform, sir, the cranial nerve number 1. This is the olfactory nerve, sir. So, prior of doing the procedure, sir, okay lang ba, sir, tissue, sir, and para ma-remove yung any mucus sa nose natin po. Okay. Okay, sir. Kindly close your eyes, sir, and as I am holding this bottle, sir, I will let you smell this, sir, and kindly describe, sir, kung ano saan siya. Okay, sir? Okay, sir.
Coffee.
Tama po. In cranial nerve number 2, this is the optic. So in assessing the optic nerve, we need to check for visual acuity. So use an eye held card and ask the patient to cover one eye and read the print. So the rationale for this is to check on how he will see the details of a letter or symbol from a specific distance. So prior of doing this procedure, I'm going to use this Snellen chart. Okay, sir, I'm going to assess the optic nerve po natin, sir, and of doing that procedure, sir, sir, kindly cover your one side of your eye, sir, and read, sir, ito po, sir.
E, F, P, T, O, Z, L, P, E, D, 4. P, E, C, F, D.
Okay, sir, another, sir, is your as a side na mo, sir.
E, F, P, T, O, Z, L, P, E, D, 4, P, E, C, F, D.
Assessing for visual fields. Prior of doing the procedure, we need to face the patient directly and ask the patient to look into your eyes or in my eyes, since I am the nurse. Then place my hands 2 feet apart lateral for patient ears. Slowly move the fingers until the patient identifies them and repeat in the upper and lower quadrant. Okay, sir, mag-perform ako, sir, visual fields, sir. Okay, sir, and I'm going to use my hands, sir, and tell me, sir, kung makita mo. But you need to focus your eyes sa akin na, sir. Okay, sir? Okay, sir. Sir, makita, sir.
Kita siya.
Okay.
Kita.
Okay, sir. Okay. Assessing for the cranial nerves 3, 4, and 6. This is the oculomotor, trochlear, and the abducens. So prior of doing this procedure is that we need to check the upper eyelids while the patient is looking directly at you, and then the eyelids should not be obscure the visions. Okay? Okay, sir. Kindly yun sa akin, sir. Okay, mag-inspect ako, sir, sa eyelids natin, sir, sa mata po natin. Okay. So, next is we need to inspect the pupils. So, the pupils should be round and equal in size. Okay, so, check ako sa pupil natin, sir. Okay, normal siya, no? Now is I'm going to do the papillary reaction by shining a light in the pupil and observe for direct and consensual reaction. Okay. Here. The other side. Okay. Next is we need to hold your fingers. So as I'm holding this object of about 10 centimeter from the patient's eyes, and observe the pupil dilation while asking the patient to focus on your finger and afar. So, sir, as I'm holding this object, sir, in my hand, sir, focus na, sir, and I'm going to inspect your total dilation. So, and lastly, I'm going to check for extraocular movements in the six cardinal directions of gaze. So, in performing or assessing the extraocular movement, we need to stand 2 to 3 feet in front of the patient and ask the patient to follow your finger as you make a wide H in the air. So, I'm using this object. Okay, sir, mag-perform ka, sir, sa extraocular movement niyo, sir. So, I'm going to perform this 6 cardinal gaze, sir. So, just follow, sir, where my finger using this object. Okay, sir. Now is I'm going to assess for cranial nerve number 5, the trigeminal. So it composed of the mandibular, maxillary, and the ophthalmic divisions. So in doing that, it should be tested symmetrically for pain, light touch, and temperature. For pain, we need to use a Q-tips, sharp and the dull ends. So we need to ask the patient to close his eyes and stimulate the forehead and cheeks at the points indicated. So use both ends, this one of the Q-tip, as you test along the scattered areas. So compare symmetrical areas on both sides of the face. Okay, sir? Kindly close your eyes, sir. What is, sir? Now is I'm going to test for light touch. So in doing the test for light touch, we need to use for using a West Ab cotton. So test in scattered areas and compare size. So the rationale for this is testing the cranial nerve number 5 is done in order for the nurse to assess of the patients to able to feel and identify the sensation of object being given. Okay. So, now is I'm going to assess for corneal reflex. So in assessing the corneal reflex, we need to ask the patient to look up and away from you, okay? And approach the patient from the side of his line of vision and lightly touch the cornea with a fine West Ab cotton. So we're going to use a piece of cotton with a sharp at the end. Okay. Okay, sir. Kindly, sir, look straight sa upward, sir. Okay, sir. So in doing this, we need to detect if the patient has strabismus and like that. So we are going to assess if the patient has those kind of findings. Okay, so again, sir. So next, I'm going to assess for cranial nerve number 7. This is the facial nerve. So in doing that, so we need to stand in front of the patient and ask to smile, frown, show teeth, puff cheeks out, pursed lips, and raise his eyebrows. And we need to close the eyes of the patient tightly against resistance. So normally the patient could do these maneuvers easily. So the rationale for this is to further inspect if there are abnormalities with regard to the patient's facial expression. Okay, sir? Kindly, sir, smile, sir. Raise your eyebrows, sir. Okay, puff cheeks, sir. Okay, sir. Now, sir, close your eyes, sir. Okay, I'm going to detect the inspect the resistance level, sir. Okay, the other side. Cranial nerve number 8. So this is the acoustic vestibular cochlear. So in assessing for that, we need to assess for hearing. So test one ear at the time and occlude one of the patient's ear with your finger. Okay. So while doing this, we need to stand 1 to 2 feet away from the patient and conceal your mouth to prevent lip reading and test for open ear. Must be whispering number or words that contain equally accepted syllables such as 99 or baseball. So after that, we need to ask the client to repeat what you have whispered and repeat on the other side. So the rationale for this is cranial nerve 8 brings sound and information about one's position and movement in space into the brain. Okay, sir. Sir, baseball. With the other side, sir. Baseball. Now is I'm going to assess for lateralization. So in assessing lateralization, we need to perform the Weber's test. So in performing the Weber's test, we need to use a toning fork and place the base of the forehead of the patient, and then we need to in vibrating toning fork to the top of the patient's head. So as I've said, we need to ask the sound is louder in one ear or in the both ears. So the rationale for this is because Weber's test is used for evaluating if there are signs of hearing loss while we are assessing to our patient. Okay, so can you hear the vibration? The vibration toning fork, sir?
Yeah.
Now I'm going to perform the ring test. This is to compare ear and bone conduction. So place a vibrating toning fork again on the mastoid process behind the ear. So this is the mastoid process of my patient, and then when the patient indicates that the sound is no longer heard, quickly place the vibrating toning fork near the ear canal. Be sure to also check the opposite ear. So the rationale for this is to differentiate the sound transmission via air conduction from sound transmission via bone conduction. Okay, so I'm going to place.
Yes.
Now is I'm going to assess for the cranial nerve number 9 and cranial nerve number 10. So these are the glossopharyngeal and the vagus. So in assessing the cranial nerve 9 and 10, we need to just simply ask our patient to say and we need to assess for the patient's voice if there are signs of hoarseness and if there are does it have a nasal quality, and we need to observe the soft palate and the uvula. So here, okay, sir, I'm going to assess your cranial nerve number 9 and 10, sir. And sir, open your mouth, sir, and say the word sir. Okay, so while I am assessing the soft palate in the uvula, of course, the soft palate should rise promptly and symmetrically, and the uvula should remain midline. So we need to inspect the anterior and posterior pillars and the pharynx. So the rationale for this is because the hoarseness, the whispering, and nasal speech or the complaint of aspiration, regurgitation of liquids through the nose should make you especially mindful of normality. Yes, sir. Yes, sir. Sir, wider, sir. Okay. Now is I'm going to assess for test for gag reflex. So in a gag reflex one side at a time. So in assessing for gag reflex, we need to use a tongue blade or tongue lip razor, and after warning the patient, stimulate the back of the throat lightly on each side in turn. And you should see a rise in the palate and other signs of gagging. So we need to ask the patient to swallow, and it should be done without difficulty and regurgitation. Okay, sir? Sir? So the rationale for this note if the patient is experiencing difficulties in swallowing that may be positive for dysphagia, or if he is experiencing painful of swallowing which may be positive for odynophagia. So while in cranial nerve number 11 is it is this spinal accessory. So in assessing that, we need to open the patients in the gown to reveal the upper trapezius muscle. So this is the upper trapezius muscle, and ask the patient to shrug his shoulders upward against your hands, and we need to evaluate the strength contraction in the upper trapezius muscle. So after, ask the patient to turn his head each side as your hand and observe the contraction of the opposite sternocleidomastoid and notice for the force of the muscle against your hand. So the rationale for this is it is because with weakness or paralysis, these functions are decreased or absent. Okay, so this is the trapezius muscle. Okay, sir, can you shrug your shoulders, sir? Shrug your shoulder. Okay. Okay, now. Yes, sir. Left. Right. Yes, sir. I'm going to assess for your jugular. The other, sir. Okay. Assessing for cranial nerve number 10, the hypoglossal. So in performing the hypoglossal, we need to ask the patient to open his mouth and assess for tongue atrophy and fasciculations. So, and after that, we need to ask the patient to stick his tongue out, note for any asymmetry or deviation from the midline. So, we must notice that the tongue should be protrude and straight out. Okay, sir? Kindly open your mouth, sir, and kindly tongue po natin. Okay, move your tongue to the left and the right side, sir. Okay, the other side. Okay, sir, thank you. And the rationale for this is to observe three observable aspects of the tongue, and that is the strength, bulk, and the dexterity. So special attention is given when the tongue is weak, atrophied, moving abnormally, or impaired. So this is check if there are abnormalities are present in the mouth or tongue, and of course, if the patient also checking for the position of his uvula. Well, sir, we're done, sir, sa pag-assess ko, sir, sa cranial nerve natin. Sir, I've actually done the physical examination, and I've actually, did the 12 cranial nerve assessments sa amin, sir. Okay, sir, thank you, sir, sa pag-cooperate natin, sir, no?
Yes, thank you rin.
So, kumusta po tayo, sir?
I'm good naman.
Okay, sir. So, continue lang pag-check up and so on, sir. Thank you, sir, again, sir, and yes.